Let's study about health assessment. What is health assessment? The definition is health assessment is a systematic and interactive process by which nurses use critical thinking to collect, validate, analyze, and synthesize the collected information in order to make judgment about the health status. Here, what they are doing in health assessment, it's a systematic, like step by step procedure, and it's an interactive process. The two persons are sharing their informations. Here, nurse should use her critical skill to collect as well as validate. She have to see the information is valid or not. Analyze and synthesize, in the sense which all information to be considered, which information not to consider. Okay, then the collected information in order to make judgment about the health status. And finally, she have to make the nurse's diagnosis. For that, she have to use her critical thinking to make the nurse's diagnosis. So, health assessment is one of the systematic way of taking information. Let's see the purposes of health assessment. First one, to gather information regarding client's health. Our first priority is to take client's information. Second thing is to determine client's normal function, whether all the functions are normal or not. To find out that, to understand the physical and mental well-being of the patient, whether the patient is physically and mentally well or not. To detect disease in early stages. Sometimes what happens, diseases has stages, first stage, second stage, and all. To know that. To determine the cause and extent of the disease. What is the cause for this disease and how far it is extended. Okay, to know that. To determine the nature of the treatment or nursing care needed for the patient. What treatment need to be given? What nursing care should be decided for this purpose? To safeguard the patient or family in case of communicable disease. For example, if you think patient has COVID, then you have to isolate the patient immediately. This is also one of the purpose. To find out whether the person is medically fit for particular task. If patient has surgery, posted for surgery, then you have to collect proper information to frame nursing diagnosis. At last, after collecting all the information, validating, synthesizing, analyzing all the information, you have to make the nursing diagnosis. So these are the purposes of health assessment. To identify need for health teaching. If the patient has malaria, then you have to give health teaching regarding malaria, how to avoid mosquitoes, how you can be safe from the mosquitoes and all. To contribute to the medical research. If you collect proper health assessment, then it is helpful for the medical research team to do their research work. There are some factors which affect health assessment. First one is physical setting, like the room or the place where you are conducting health assessment. If the room is silent, well equipped, then your health assessment will be very smooth. If very noisy and the weather in the room is not good, then you are not able to do a health assessment in good way. Client's personality and behavior. If the person's behavior is not good, if he is rude so you are not able to do proper assessment. Communication skill. The language which patient knows and which patient is comfortable to share the information. If you know that language, then your health assessment will be better. Nurse's personality and behavior. Your personality and behavior should be important to do health assessment. Nurse's knowledge and skill. You should have proper knowledge and you should know how to conduct health assessment. You should be experienced enough to do health assessment. Thank you. We'll continue regarding health assessment in the next class.